our clients focus on this as a measure as they're looking to improve experience, CAHPS and STARS. And I think everyone is very aware of the increased weighting of CAHPS and the access to care measures for the Medicare Advantage population. So the importance of getting those members into their providers and to get it in a timely fashion, whether that's routine care or urgent care. Obviously, multiple questions pointing towards those access measures. The other is understanding how access to care really is the gateway. So if you think about this from a member experience perspective, the same way you think of onboarding members through your sales channels, this is really the first step in terms of getting those members into the care environment. And if you're going to have an impact on those HEDIS measures, on care gap closures, you need to make sure that those members that haven't seen their providers are getting in to see the providers, or those who haven't had care gaps closed are, again, being seen in a timely fashion, especially ahead of CAHPS season. We're out of open enrollment. We have a slew of new members who may have joined our plan. So navigating your plan, both whether it's open and from more of a PPO perspective or you have kind of a closed network, ensuring your members understand how they can best access care, whether they're a legacy primary care physician, hopefully they're a part of the network and they're available to see that legacy provider, or if they need to be connected with a new primary care provider or a specialist, how are you going to make those connections? The other is ensuring members are engaged ahead of season. So we know based on our data, members who are less engaged with their health plan, and then I think more specifically, members who have not seen a provider recently, whether that's 3 or 6 months, depending on kind of their chronic conditions or care needs. But if they haven't seen somebody in 6 to 12 months in particular, they are not going to be high raters. So chances are they're not very satisfied with their health plan, with their experience if they're falling into that category. So identifying and cohorting those members now, reaching out to them now, trying to close those gaps ahead of measurement season is essential so they can get in to see their providers. And then ensuring that you are able to meet your other value-based care initiatives. So especially if you think about D-SNP populations, ensuring that there's access from a Medicaid perspective, so straight Medicaid, or again, any other value-based contracts or value-based approaches you have to your membership. The only way you're going to close those care gaps, identify how to do that with populations who may have particular issues around social determinants of health is really important.